The men and women crunching the numbers for our state say they actually expect these upticks. In the blizzard of facts and figures the state sends out every day, THV 11's Rolly Hoyt asked one of those scientists for help putting them in context.
Every day it's must-see TV when Governor Asa Hutchinson and Dr. Nate Smith update us on the new cases using charts and graphs. There's a lot of data crunchers generating those multicolored slides. But we asked Dr. Austin Porter, the Deputy Science Officer for the Department of Health, for help interpreting what all those circles and the arrows mean.
It's always a challenge, dealing with something that is so fast-moving as COVID-19.
If it's hard for this doctor and professor, imagine how we feel out here in TV land.
I believe now everyone is getting a crash course in basic statistics.
Well, that crash course has taught us that getting a handle on fast-moving numbers can be confusing. The big chart that we see every day is the number of new cases. As we crunch the numbers, THV 11 pointed Dr. Porter to a discrepancy in one of the charts. It seemed to indicate a whole lot more cases back in late March than actually got reported. Dr. Porter called it a glitch and said that their graph will match up with ours very soon. So we figured this out. Now what do we make of all the recent upticks on this side of the graph?
We anticipate to see moments of uptick in our data, as parts of the economy open up.
Porter and his bosses expect these upticks to come from clusters like we're seeing in Forest City. But Porter isn't seeing these trends through rose-colored glasses.
To me, when you pull out the clusters, it shows more, kind of more a stabilization of the numbers.
The governor seemed to reach the same conclusion Thursday. He's being cautious about setting dates for phase 2. For now, Dr. Porter has his eye on two key stats amid all the noise of the numbers.
You want to look at hospital admissions, vent use, those types of metrics to really gauge, the extent of the disease.
Rolly Hoyt, THV 11 News.
Thank you, Rolly. Our hospitalization numbers continue to be much better than other parts of the country, but keep in mind they are what's called lagging indicators. New cases today might not become an admission to a hospital for several days to follow.